Ever felt like sex ends too soon, even before it really starts? You're not alone and you're not broken. There's actually a name for this, and more importantly, there are real science backed ways to help. Hi, I'm Dr. Camilla, host of the Intimacy Lab for Ubi Health. As one of the AI faces of Ubi's global network of over 1,200 medical providers and backed by insights from more than 12 million users, I'm here to help you separate fact from fiction, especially when it comes to issues around sex, sexual health, relationships, and intimacy. With so much misinformation floating around online, it's more important than ever to get doctor approved info you can actually trust. Today, let's gently unpack premature ejaculation, what it really is, why it happens, and what you can actually do about it. Because despite the shame that often surrounds it, this is a deeply common experience. In fact, around 1 in 3 people with penises say they've dealt with it at some point. Let's take one of my patients. Let's call him Alex. Mid-30s, in a loving relationship, but felt anxious every time sex was on the table. Not because he didn't want it, but because he was terrified of disappointing his partner by finishing too quickly. He described it perfectly. It's like trying to hold water in your hands. Even when you're trying hard, it just slips. That shame? That pressure? It often makes it worse. Medically, we consider ejaculation premature when it regularly happens within 1 to 2 minutes of penetration, and if it causes distress or disrupts intimacy. But timing alone isn't the full picture. Emotional impact matters just as much. Now, how does this happen? It's not just about willpower or mental control. It's rooted in biology, a reflex controlled by the spinal cord and influenced by how your brain interprets stimulation. There's evidence that serotonin, the brain chemical that helps regulate mood, also plays a role. People with premature ejaculation often have serotonin receptors that aren't doing their job as well, which leads to less control over that reflex. So, what can you actually do? First, and this is important, ask yourself if this is something you and your partner both want to work on. If you're both satisfied, there's no right duration you need to meet. But if it is bothering you or creating stress, know that there are multiple paths to relief. One powerful tool: communication. Talk to your partner. Explore what intimacy means to each of you. Is it just about penetration, or are there other equally fulfilling experiences you two can enjoy together? Now, onto practical strategies. One approach that's helped many couples is the stop-start technique. During sex, just before ejaculation feels inevitable, you, or your partner, slow down or stop stimulation altogether. Doing this 2 or 3 times per session can improve ejaculatory control over time. It's like training the body to recognize and recalibrate that reflex. Then there's the squeeze technique, applied directly to the base of the penis when you're getting close, which slightly decreases arousal and allows you to keep going longer. A little mechanical, yes, but surprisingly effective. There are also over-the-counter solutions like topical numbing sprays. These reduce sensation, which can help delay ejaculation without requiring pills or prescriptions. Just remember, always follow the label instructions and wash off before oral sex. Still feeling like you need more support? Psychosexual therapy can be incredibly effective. A trained therapist can help unravel the anxiety, guilt, or histories, like religious trauma or past rejection, that may be contributing to your experience. Studies show therapy combined with techniques like stop-start can significantly extend time before climax, sometimes up to 8 times longer. And while meds like SSRIs or certain pain meds can sometimes be prescribed to delay ejaculation, they do come with side effects like reduced libido or fatigue. Always talk to a licensed provider before going that route. The bottom line: premature ejaculation isn't a character flaw, it's a treatable reflex, one that your body learned and one that it can unlearn. You're not broken or alone, and your pleasure deserves care too. Worried about your own health? Start by checking in with the Ubi Symptom Checker at ubihealth.com. Its medical-grade doctor-approved AI is like having a full-on call healthcare team right in your pocket. Always 100% free. And if this video helped you feel a little seen or a little more informed, like and follow for more doctor-approved info you can trust from all of us here at Ubi Health.